Hello friends, today we're going to discuss about avoidant personality disorder. I'm Dr. Suresh Badadmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. In this video, I'll be discussing about avoidant personality disorder, diagnosis, prevalence, and management. What is this anxious-avoidant personality disorder? Many a time, it is also called as avoidant personality disorder. Here, they will have extreme social inhibition because of they feel they are inadequate, they have low self-esteem, and they feel socially they are inept. They are highly sensitive to criticism or rejection. If you look at this diagram, it clearly indicates how anxious avoidant personality disorders are. Invariably, they will have fear of social judgment and criticism. Hence, they will have fear of social situation. They avoid going to social situation. During social situation, they will have sweating and blushing, fear of being embarrassed in social situation, excessive worry about social situation. Invariably, the person with anxious avoidant personality disorder stems from low self-esteem. Let's look into the DSM-5 criteria for avoidant personality disorder. As per anxious avoidant personality disorder, DSM-5, it clearly says there should be a pervasive pattern of social inhibitions, feelings of inadequacy, and hypersensitivity to negative evaluation. And these symptoms should be present in most of the context of life. And they should have at least 4 symptoms of the 7. What are those symptoms? They should avoid occupational activities that involve significant interpersonal contact, and they are avoiding this because of fear of criticism, rejection, or disapproval. And they are unwilling to be get involved with people unless they are being liked by others. They show restraint with intimate relationships because of fear of being shamed or ridiculed. They will have preoccupied being criticized or rejected in a social situation. And APD also show they are inhibited in new interpersonal situation for because of feeling of inadequacy. They view self as socially inept, personally unappealing, or inferior to others, and unusually reluctant to take personal risk or to engage in any new activities because they may prove embarrassing to them. APD is one of the leading risk factor for severe depression, anxiety disorder, substance dependence, eating disorder, or chronic pain. Presence of avoidant PD has a direct impact on the course and outcome of any illness such as obsessive compulsive disorder. Let's look into the prevalence. The prevalence of avoidant PD is around 2 to 5%. Let's look into the differential diagnosis. As you know, anxious avoidant personality disorder starts in adolescent, and they are pervasive and present in most of the situation in life. That means it is there wherever they go. Whereas social phobia is very specific in social situation. Here, invariably, they feel they may lose control. They may do something weird in front of others, and the people will ridicule them. Invariably, the cognition is losing control. That is where social phobia, and it is pertaining to social situation. And this does not occur in one-to-one situation. Whereas in anxious avoidant personality disorder, invariably they will have low self-esteem even in one-to-one situation also. That will be the characteristic differentiation between social phobia and AAPD. If you look at the GAD, as I mentioned, AAPD starts at adolescent, feeling of inferior, feeling of incomplete, and also incomplete in any relationship. They have poor insight about their feeling, insecurities, and worthiness. Whereas if you look into generalized anxiety disorder, they will have constant worry, feeling on edge. They worry about the day-to-day events that they will become negative or they will not be able to control them. That means they will be in a constant edge that will be regarding the day-to-day events. Let's look into the challenges in diagnosis of AAPD. Unfortunately, anxious-avoidant personality disorder comes in a comorbid condition such as depression, generalized anxiety disorder, social phobia, panic disorder, agoraphobia, and various other anxiety disorder. Substance use and somatization disorder complicates the diagnosis of AAPD, my dear friends. Let's look into the management. The management of AAPD is the first and the foremost diagnosis. We need to do a detailed evaluation, clinical interview, observation, and collecting collateral information from multiple sources. Projective test can be done. Various other general personality disorder assessment scales such as SPI, SCID-5, Minnesota Multiphasic Personality Inventory 2, Mellon Clinical Multi-Axial Inventory 3, and Personality Diagnostic Questionnaire 4 can be used. With specific to AAPD, Adult Attachment Projective Picture System, Experience in Close Relationship Revised, scales can be utilized. With regard to treatment, there are hardly few studies with regard to avoidant personality disorder. Hardly few RCTs. There are few open label trials are there. Hence, recommending evidence-based treatment for AAPD is very far. That means we do not have strong research base. Borrowing information from other disorders, SSRIs, and psychotherapies can be indicated. There was a study done by Simon and his colleagues with regard to meta-analysis of cluster C personality disorder. In that, they summarized by telling we can try cognitive behavioral therapy and psychodynamic psychotherapy. However, there are various open label trials with regard to using of DBT, group therapy, social skills training, CBT, ERP, and mindfulness training for anxious-avoidant PD. Similarly, the World Federation of Society of Biological Psychiatry guidelines recommends that SSRI can benefit cluster C personality disorder, which includes anxious-avoidant personality disorder. Invariably, the presence of AAPD with other psychiatric diagnoses such as OCD, depression can worsen the situation and course and outcome. Medications such as SSRI can be used for treating anxiety disorders and other comorbid conditions. To conclude, my dear friends, avoidant PD is very common. It is around 2 to 5%. Comorbidity is the rule in anxious-avoidant PD. There are hardly few RCTs available with regard to treatment, course, and outcome of AAPD. Available evidence indicates towards CBT and psychodynamic psychotherapy. SSRIs can be used in treatment of avoidant PD. Thank you very much for giving your valuable time. Stay safe.